Good afternoon, everyone, or good morning, depending on where you might be located. Thank you for joining us today for the Social Accountability and Community Engagement webinar. I am Melissa Frill from Holleran, and we have a few other people here willing to speak with us in a little bit. I just wanted to run through a few housekeeping items before we begin. During the webinar, everyone is currently on mute. That's due to the large size of the webinar. So we have disabled the ability to raise your hand and ask questions or to verbally ask questions. But what you will see on the side there, you can actually type in your questions, and we'll keep track of that throughout the webinar. We do have some time set aside at the end to answer those questions. So like I said, you don't have the ability to raise your hand, but you do have the ability to ask questions through typing, and we'll keep track of those throughout the course of the webinar. The last thing I wanted to say is we are recording this webinar. So for those who have some colleagues who cannot join us during this time slot, I know we have had some questions about this. Or if anyone wants to watch the webinar again, we are recording this webinar, and it will be available on the Holleran website and I believe on Leading Age's website as well. So as I said before, we've got a couple people here willing to talk to us today about social accountability. And Peter, do we have you on the line? Okay, I think we're going to go ahead and continue with the webinar. And I've got Becky Lochner here from Holleran's office, and she's going to help us with Peter's presentation. So, yeah, do you want to back up a second? Okay.
Okay, so it seems like we're having some technical difficulty, and we've lost Peter Notistrofano, who I'm sure a lot of you are familiar with. He is the Director of Home and Community-Based Services for Leading Age. And Peter was actually part of organizing this webinar, and so if he joins us, he can interject at any time. But in the meantime, one of the things that I know was important to him, and in our discussions with Peter we've talked so much about, is why social accountability is so important. And we've been talking about this as it relates to CCRC providers for some time now. But as it relates to home and community-based providers, it's also really important for one, because as all of you are trying to be a provider of choice, it's important for you to really paint yourself in the right light as a mission-driven organization who extends your mission to meet all of the needs of all of the the members of the community. And so it's important to really identify what the needs of the community are, and then to get some support from your local, state, and federal officials. And the best way to do that is to do some research. We're going to talk a little bit about that during Holleran's portion of the webinar. But it's important to have some data about the needs of your greater community so that you are very clear about how to serve that population. So one of the things that Peter implemented for us in the recent couple weeks was a survey that was conducted probably among some of you who are listening to us right now. We did have about 40 members who responded to the survey, and we're just going to talk a little bit about those results right now. Just in terms of the type of services that have been provided from the 40 respondents, you can see the breakdown here. We had adult day services, the traditional home care, home health, hospice, the PACE providers, meal programs, transportation, and you can see how that breaks down there. And then 40% of the respondents also offer some other type of home and community-based service. So that's the breakdown that we're looking at in this data. The organizational structure, 40% of the respondents were freestanding providers of home and community-based services. 30% were connected with a continuing care retirement community. 20% are connected with senior housing, and then 30% are connected to a SNF or an AL organization. So the other question that we asked, and hopefully this is something that all of you are thinking about at this point, even if you did not respond to the survey, And that's, where do you address accountability? Do you address it in your strategic plans? Well, 72% of the respondents in the survey said yes, it is written into their strategic plans. 66 or 60, almost 67% address it in their budget. 78 or so percent address it in their mission statement. And then we also asked if you have a social accountability report, and if it's actually a separate report or if it's in your annual report. And 47.5% said that they address it in a separate social accountability report, and others do mention social accountability, but it is part of their annual report. So you can see what others are doing, and hopefully these are all part of discussions that you're having within your own organization. Our recommendation is that social accountability definitely needs its own report. So if it's something that you're including in your annual report right now, that's great. You're definitely ahead of others. But it's definitely something you want to be thinking about to produce the social accountability report and really, really highlight your social accountability efforts separately from the general annual report. We also asked what tools are being used to collect the data for social accountability. And when we talk about social accountability data, we're talking about what activities are being done for social accountability, how many hours are going into that, what staff are a part of that. So some of those statistics are being collected right now in a general spreadsheet. Some are using a specific database. And you'll see that a large group of the respondents are not really collecting their social accountability data at all. So I think right now that's where a lot of organizations are. So if that's you, you're certainly not alone in that. It's something that we're finding that is kind of on everybody's to-do list, but not everybody has gotten to it yet. But you really need to find an effective mechanism for tracking all of your social accountability activity. It'll be really, really critical for you to be able to look back. It's important for planning purposes, and it's important for you to be able to demonstrate your social accountability in that report that you put out each year. So we talk about some of the challenges that some of you are experiencing in implementing a program of social accountability. And you can see here, again, there were 40 respondents. So you can see that some are experiencing regulatory barriers, lots are experiencing staffing shortages and lack of funding, and then there's several other reasons that are coming up as challenges for social accountability programming. We also asked if your organization has at least one individual who is clearly defined as the responsible party for social accountability. And again, this is something that is part of the very beginning of your social accountability efforts, is establishing who is going to be the owner of this within your organization. Who is going to be the one tracking? Who is going to be the one who is implementing the programming and gathering the data? And so we asked out there, who has someone designated, and you can see that breakdown. So some strongly agreed. 23% said that, yeah, they have someone who's been clearly defined. And then you can see that others are sort of on the brim. They have somebody, but they only, rated that and agreed. And then some are disagreeing and strongly disagreeing with that. So you can see that breakdown. And then taking a look here at some of the activities that are provided for free that count as part of your social accountability efforts. And most likely these are things that your organization probably offers too, but here were the big ones, and you can see that breakdown there with different health screenings, education, just provision of information. You can also see here, I want to point out the services that are not reimbursed. And that's probably one that most of you are focusing on right now. And that's certainly, one piece of the pie, but it's really important for you to have a robust program, for you to take a look at all of these other pieces of the pie as well. You can see just with these activities that there is a lot of information to be tracked. So this is why it's crucial for you to have a tracking mechanism that really, really gets at the hours spent on the planning of these things, and then what the benefit is to the community when you have these activities. Okay. And one of the last things I'll say is that with the survey, before I hand this over to Melissa Frill, you know, we have conducted a social accountability survey among CCRC providers in the past. Holleran teamed up with Leading Age back in the end of 2010. And one of the things that we find, I'll just offer some anecdotal information, but, you know, we didn't have as many respondents as we would have liked for that study in 2010 or for this one that we just recently conducted in June. And part of what we were finding is that a lot of organizations just aren't here yet to be able to answer some of these questions. So if you're finding that, you know, you don't have the answer, or you wouldn't be able to answer a full survey with some of the things we just looked at, you're certainly not alone in that. But this is just all the more reason for you to start the planning process. And Melissa's going to talk here in a minute about the 5-phase process that we recommend. But you know, I think that when we do a study like this in coming years, we'll have a lot more respondents with a lot more information as it becomes available. So I'm going to turn it over to Melissa Frill, who's our Marketing and Communications Associate here at Holleran. Here you go, Melissa.
All right. Thank you, Becky. Thank you very much. Hello, everyone, again. I am Melissa. Let me just continue in my PowerPoint. All right. So you may be wondering, like, what is Holleran's role? And Becky spoke a little bit to it. We are committed to assisting not-for-profit senior service providers in this quest for social accountability. And with over 20 years of experience in the community benefit and social accountability consulting, we felt compelled to contribute an educational component to those who are looking to begin or continue on this journey. So that's kind of how we got our start in all this. And then in May of this year, we released the Holleran Social Accountability Toolkit, and it was written with CCRCs in mind. However, there is a great deal of information in there that does provide to HCBS providers lots of good tips and tools to get you through, including the Holleran Social Accountability Model, and you'll see that on your screen there. It is a 4-tiered model. Beginning with commitment there at the very bottom. We believe that that is the most critical because it is your foundation. You really need to have that buy-in from everyone within your organization, get all the stakeholders on board to successfully implement any next steps. Once you have that commitment from within your organization, we think the next step should be discovery, and that involves a little bit of research on our end, even as senior living professionals and experts. There's still a great deal to learn what things we're offering that work, what things we're offering that don't work, really find out what the needs of the community and the internal community is. Once you have gone through the discovery and you've figured out what it is that you need to put in place, we have program development. So creating a plan that's really going to take you to the next step in your social accountability journey, get something in place that really works. And then lastly, telling your story, and that's both from an internal and from an external aspect. You want to make sure everybody internally is on board and understands what it is that you're doing, and you also want to make sure everybody outside within the community understands what it is that you're doing and sees the good work that you are doing. And then you'll see there on the side there we have some arrows: sustaining and evaluating. That's because this is an ongoing, it's an ongoing process. You don't just go through these steps and you're done. You're constantly looking back and reevaluating and making sure that your social accountability plan is relevant and current and is addressing the needs of the community right now. So without further ado, I'm going to introduce Becky Harvey. She is the director at Entrusted Hearts, and she's going to tell a little bit about her story. And I am going to pass over control here in a minute to you, Becky.
Thank you, Melissa. I am excited about this opportunity to share our story. of our Friends team.
Be able to go ahead and give it a go.
Okay, thank you, Melissa. Thank you very much for giving me this opportunity to share our story here with the Friends teams at the Baptist Villages of Oklahoma and what we're doing through our Entrusted Hearts. It's our home care ministry. We believe that social accountability is an important component of the Baptist Village Retirement Community's mission statement, which is to honor God by providing quality living and compassionate health care in a Christian environment. Let me see if I can switch to the next slide here. There we go. Well, it went to. How do I go backwards, Melissa? Well, that's okay.
Go backward.
Okay.
There you go.
Thank you. Thank you very much. We are a not-for-profit ministry of the Baptist Villages, and the villages have been in existence 54 years. We started in Hugo, Oklahoma. We've now grown to 8 villages. We have 5 home care offices in Oklahoma, plus the medical equipment office. Our home care has been serving for 18 years by providing skilled care and therapy and personal care to Oklahoma residents. We have Medicare program, Medicaid, and Advantage waiver, our state waiver program. We serve people with commercial care insurance, and even people who pay privately, we provide services for them. And so does our medical equipment company. They serve many people in Oklahoma, supplying medical supplies and DME. And we use the spreadsheet to track our social accountability services. As you see, it's just a simple Excel spreadsheet that's been developed in our development department. And in the first column, it's the date of service or the day of the event. We log that in. And then we put in what the exact event or the description of that event or person. Could be a person that we've ministered to. So we put that there. In the next column, how many people were there at that event? And then we put in, were there volunteers, how many volunteer hours were involved? And then staff hours. If we have staff who are serving during part of their regular working hours, we allow for that. So we put in how many hours that were involved and what was the expense. So it's the number of hours times their wage, their hourly wage, to let us know how many staff hours and how much our labor expense was. And then any other expense we track. For example, if we've seen some people who were diabetic and used finger stick blood sugars, we count how much the strips cost, so we would put that here. If we happen to see people that have no source of payment for their home care, we would put that in here, including any supplies we may have used. For example, we've done wound care, so we'd put the wound care supply here. And then this Excel spreadsheet automatically tallies the expenses. If there were any revenues that were donated to help with that particular event or service, then we put that in this column that says offsetting revenue. And then in the final column is the actual program cost. And then the director in each of our home care locations would complete this and send it to our development team quarterly. So any non-reimbursed expenses such as the nurse's wage would be put on this spreadsheet along with what the service was and sent to our development team. Now, some examples that we have on this next slide of some of the things that we do include on this social accountability spreadsheet would be like in our medical equipment office. We have what we call a missionary pile, and as one of our team members said, it's not a pile of missionaries waiting to be sent out, but it's a pile of donated items waiting to be sent out. So our medical equipment team would receive these donated equipment items. They'd prepare them, refurbish them, clean them, verify that they meet standards set by the manufacturer or by our accrediting body, and then deliver the item wherever it's needed. And if need be, they will give instructions on how to use the equipment. An example is the Hope Community Services of Oklahoma City. We're desperate for ostomy supplies. Well, the Hope Community Services deals with those individuals who are homeless, and they have very few resources to be able to help their clients with medical needs. So our equipment company got a call, and were able to supply those ostomy supplies to the Hope Community Services, and then in the meantime learned that they also needed diabetic supplies. So we were able to supply those things as well. And so both of those things, all of that would go on this spreadsheet. Another example was in Owasso. The community center there was in need of a wheelchair and a transport chair for the people that come to the community center for activities. They needed wheelchairs, so we were able to donate those things. Through our missionary pile, in the first 2 quarters of this year, we've replaced or repaired 6 hospital beds. We've provided transfer benches, shower chairs, bedside commodes, walkers, crutches, wheelchairs, nutritional supplements, diabetic supplies, various incontinent items, wound care supplies. And so you see we have many opportunities open to us to help serve people with unmet needs in our community. Now another example is in our Oklahoma City location. Our nurses there in that home care office serve residents in what we call the JELP Center. It's a low-income senior housing apartment building. The Entrusted Hearts team sends a nurse twice a week to assess health needs and to provide health education and coaching. And more than once, a resident has come into the clinic there complaining of chest pain, and the nurse had to call an ambulance and send that resident to the hospital. And sometimes it's resulted in surgery or open heart surgery. And so we really helped in intervening in a significant way. We also provide free flu clinics to the residents there at the JELP Center, as well as other communities in Oklahoma. Now, if the individual has Medicare, we do get permission from them to bill their Medicare, but otherwise it's a charitable service that we include on this spreadsheet. In 2011, we served over 2,000 individuals as part of our social accountability program. Now, the social accountability activities are published in our annual report and distributed by direct mail and on our Baptist Village website. Those in the mailing list include over 5,500 individuals. In this very last slide that I'm showing you here, you see that our Friends team are meeting with our Governor, Mary Fallin, and one of our state senators, Rick Brinkley. These are also people who receive our annual report on the social accountability activities that we perform, not only through our home and community-based service through Entrusted Hearts, but through our Baptist villages too. And when we tell our story of social accountability, we'll enhance our reputation, we earn public trust, and we increase the confidence of the consumers we serve and their families. Thank you, Melissa.
Thank you, Becky, very much for sharing your story. Now, before I pass it over here to Bill, we are getting quite a few questions about whether or not this presentation will be available. And both the audio recording and the PowerPoint will be available on Holleran's website. That is holleranConsult.com, HOLLERANCONSULT.com. It will be available there for everyone to view in our Holleran library, and I'm sure it will also be available on the Leading Age website as well. So without any further ado, I'll pass it on over to Bill. Go ahead, Bill.
Hi there. Well, there's a lot to start with. First of all, social accountability has been at the basis of the Daily Living Center since it was begun in 1974. There was a need for adult daycare in the area, and there was nothing for the families. So a group of individuals, some college professors, some wives of some doctors, all got together, and in 1974, they created the first daily living centers, and it was named by the participants at that time, and it has maintained that name since that time. But it was a small group of people that, because of stroke or because of some kind of illness, could not be left at home by themselves during the day. But they did not need institutional care. We have a lot of people that will come in that may need to be in a nursing facility or an assisted living, and because of our case management, we will guide them to those areas. But if they don't fit, they will and can come to the daily living centers, sign up for it, and take advantage of all the services that we have. One of the things that we feel very strongly about is that we have, as a not-for-profit particularly, we have to take care of people's money. People give us a lot of money. We earn a lot of money. We get a lot of grants. So we do not hide anything. Everything is full open. We have a website, www.dailylivingcenters.org, that has our 990 forms on it. It has all the things we do listed and any information. Plus, there's a place on the website to ask questions, and someone gets back to the person or the people asking the questions and will try their very best to answer the questions. But we are here to serve the population, and we were the first in the state of Oklahoma. I have been here now, this is my 25th year after a career in education. So when I came here, there was 5 daycares in the state of Oklahoma. There was no rules and regulations. We worked very hard with some of my former students in the legislature to write an Adult Daycare Act for Oklahoma. That was just to say, this is legitimate, we're doing it right, and there's certain rules and regulations you're going to have to follow. The Adult Daycare Act is 4 pages long. But in that act, we went to the Department of Health and asked them to write the rules and regulations for adult daycare in the state of Oklahoma. They gathered a group together. I was on that group. There were about 8 or 10 people, some physicians, some caregivers, a couple of providers, and some health department folks that sat down and wrote over a period of about a year the rules and regulations that would make adult daycare very open to anybody in the public. It tells you exactly what to do, and if anybody wants to start an adult daycare, which we welcome, all they have to do is follow those rules and regulations, because it is telling you every step that needs to be taken to satisfy the license requirements of the health department. And since 1992, adult daycare in Oklahoma has been licensed. Within the last year, beginning the 1st of July of this year, and culminating on October the 1st, a new law has been passed in the state of Oklahoma that the adult daycare administrators will have to be licensed administrators. Just like nursing homes have licensed administrators, in Oklahoma we're going to license nursing home administrators, assisted living administrators, daycare administrators. Every phase of elder care is going to have licensed administrators. Now, that will not take effect until October the 1st, and anybody that is doing it right now will be grandfathered in if they've been an administrator for at least a year. But after that, there's a training process they're going to have to go through and an application process, and it's going to have to go through the Oklahoma State Board of Examiners for Long-Term Care Administrators, which has been established. And that board licenses the administrators, takes complaints, hears complaints, and has hearings if need be. This is all part of the accountability and social accountability to the population of the state of Oklahoma. They're going to have people there that have had basic training, and they know how to operate, supposedly know how to operate these centers. Sometimes there's going to be mistakes, but not much. Since I've been here in the 25 years, there's only been 2 complaints that we've had at the daily living centers, and they were not personal complaints. They were financial complaints, but they were resolved very quickly with the caregivers. Our clients are not the persons we see every day. Our clients are our family members that are giving care to our participants. We have 4 centers in the Oklahoma City area, and we serve approximately 150 people a day. Most of these people are either stroke victims or have dementia of some type. A lot of people say just Alzheimer's, but it could be vascular dementia or any other type of dementia that we work with. We do have a few younger people that are developmentally disabled, but just a few. And they work extremely well with the older individuals that we have in our centers. We have a lot of activities. We have an activities director that plans activities. We have over 25,000 volunteers a year come in and put programs on in one of our 4 centers or maybe all of our 4 centers. But they come in, they work with our activities director, they make presentations. We have educational presentations, we have fun presentations, we dance a lot, we sing a lot, and we just have a good time. We've tried to hit everyone. One of our things is that we have large open spaces in our centers so that more than one activity can be going on at any particular time. But because of the large open areas, the nurse, which every center has at least a licensed nurse in the center, and all of our staff are at least certified nurses' aides through the state of Oklahoma. So they are working, and this is all publicized so people will know what they get when they come in here. We watch their meals. We don't necessarily say that we do breakfast, but we do breakfast. We have our lunch meal catered in, and for those that stay late, we'll have snacks late in the evening. In the state of Oklahoma, you can only operate a center 12 hours during any 24-hour period. We don't think that that should be limited like that because we would like to also offer an evening daycare. But the way the laws are stated right now, we have not been able to do so. But we're working on it. We're working with the legislators, and we're trying to get funding. There's a special funding mechanism in Oklahoma that comes through the Department of Human Services, the Aging Services Division. And there's been about $2 or $3 million over the years that has been put in this to help people that can't quite afford to pay for it but still need the center, and they don't have an income to, I think the income level is about $2,000 a month. If they have less than $2,000 a month, they're eligible for some of the services that we can get through there. But we have to get it re-upped every year through the legislature. So we have to have good open communications with our legislators, and that's where our accountability comes in. Every time we have a person come in, we can sometimes make exceptions to their payment. We do not turn anyone away regardless of their payment. We have United Way funds, which we give families as scholarships so that they can pay for the service. We have the DHS, Department of Human Services program, that we try and get people fitted into if they fit the criteria, and sometimes they will have copays. A lot of times families cannot meet those copays, so we give them sliding scale fees, just like private pay. Our fees are $60 a day, and that includes all of our activities. That includes the nursing care, that includes bathing. We have bathing. We have a special $12,000 bathtub we bathe individuals in. We wash their clothes. We do all their medications. We do a transportation system. We have 10 limousines that we got from donations, either from funeral homes or individuals donating us the dollars. And we have a lot of information on these limousines that we pick people up with. And people have called us driving behind the limousines and saying, okay, I saw this limousine, I saw who you picked up, what do you do? And that has been very helpful to us. Oklahoma City is a rather widespread out area, and we're all over with our limousines. We also have 4 handicap vehicles, vans for our wheelchairs. We take people during the daytime. We use these things to bring people to the daycare centers in the morning and take them home in the evenings. But during the day, they're sitting there. So we did write a grant, and I got it funded, so that now any frail elderly person that's in the community that needs to go to grocery shopping or needs to go to the hairdresser or needs to do something to maintain themselves in their home and in the community, we've advertised it, and we provide these services to them. Like I said, when they come in, we put down all the information we can about them, what they can afford to pay, why they don't pay the full amount, etc. And every month, this is sent to our CPAs. And our CPAs then ascertain how much free care we have given for the year. The last 5 years, we've given $1.5 million worth of free services to the community. We publicize this. One of the things I did with the legislators this year, I pointed out that last year we had 816 Department of Human Service clients or participants. DHS paid us $648,000 for that. That was still $72,000 less than what we spent on those clients. But if they would have gone to a higher level of care, say a nursing facility, the state contribution would have been $13 million, and the total contribution, counting the state and federal income, would have been $37 million. When our legislators see how cost-effective it is, they were very impressed. And we do this every year to show them exactly where we are. We try and get as many daycare centers in the state to tell us exactly where they are on this, so that we can present it to the legislators and to the community. Like I said, we're a United Way agency too, so we're out there speaking. We not only talk about our centers, we talk about what we can do to help the community, whether it is in one of our centers or whether it is just in the activities we do. Our bathtub, for example, we find that a lot of individuals that are caring for people with dementia have difficult time bathing. So we have these bathtubs. The door opens, they have a seat in it, you close the door, you push the button, the whirlpool action comes in, the chemicals come in, you wash the individuals. It takes about 15 minutes. They don't seem to mind it. It's pretty easy. And we have people that come in from the community. We charge just I think it's $15 for a bath. It just covers our cost barely. And they just come in for bathing maybe once a week, once or twice a week. And this is advertised to the community. These ways the community can see our social accountability to the community and to the people in the community. We think that that is the kind of thing that's going to help people whenever they need it. And I probably could go on forever, but I think that's probably enough unless anybody has a particular question.
That's wonderful.
Melissa, it's back to you.
Thank you very much, Bill. That was all wonderful information. Well, while we've been running through the webinar, we have been able to work out some of our technical glitches, and Peter was able to join us. Peter, can you hear us now?
Yes, thank you. I actually was able to hear you. You weren't able to hear me. So okay. I appreciate it, and thank you, Melissa.
Well, welcome, and everyone. This is Peter from Leading Age, and he has a few things he would like to say about social accountability. But in the process, we do want to remind you, if you have any questions, you can do so on your GoToWebinar panel. There on the side there, you can type in some questions, and we are monitoring that if you would like an answer while we're on the call. Okay, Peter.
Yeah, if we could go back to that that first slide or second slide, why social accountability is important, I mean, I'd like to thank Melissa Frill and the rest of the Holleran staff for all their work that they've done on social accountability. Our continuing care retirement community members have benefited from their social accountability information, and I'm sure that our home and community-based services members will also find this information useful. Social accountability is important no matter what provider type you are. The competition right now for home and community-based services has really become challenging. No matter where you are in the country, there's been such a huge growth in home and community-based service options, which is positive for the industry and also positive for beneficiaries who want to remain in their own homes. For home health alone, there was a 3% increase in the number of home health agencies in 1 year from 2010 to 2011. There are more than 12,000 home health agencies nationwide right now, mostly for-profits. In some areas of the country, there are over 100 home health agencies in one catchment area. So the competition is fierce. In hospice, there are over 3,500 agencies. There was a 3% increase in the number of hospice providers over the last 3 years. Almost all for-profits for hospice growth. 54% of all hospices are now for-profit. In adult day services, there was a 35% increase in the number of adult day programs over the past 8 years. 71% of adult day providers are not-for-profit right now, and mainly that's because of the reimbursement issues, that the Medicaid reimbursement is still fairly low, and that's why the for-profit providers haven't really gone into adult day as much as the other provider types. But social accountability helps us stand out as not just being another provider in our community. It helps us be the not-for-profit provider that is going to really make the difference in an individual's life. We're not only competing for clients, we're also competing for federal and state dollars, like Bill had mentioned, as well as support from our legislature on regulations, payment systems, and also encouraging them to increase the number of home and community-based services that are available in each state. If you look for home and community-based service options in the Affordable Care Act and in other legislation that was passed over the last 6 years, you'll find that there's only been about 5 or 6 programs that promoted home and community-based services. So it's really important for us to really get out there, that members of Congress know about us, and they know that we're not just a home health provider in the community. We're not just an adult day provider. You know, that we're active in our communities. It just helps us stand out. The majority of states spend less than half of their budgets on home and community-based services. We need members of our communities to really get the message out, and social accountability helps us do that. It helps our community really stand up for what they want as consumers, and they want home and community-based services. If our potential customers and state and local politicians learn all about the activities that we provide our communities, they're going to be the politicians are going to be less likely to recommend cuts. They're going to see that we are vital for the future of our communities, of the communities that they represent. So, you know, I think we really need to commend Bill Weaver and from the Daily Living Center and Becky Harvey for sharing their story. Becky Harvey from Baptist Village. We have a number of members, 42% of our membership, and we have 6,000 members at Leading Age, operate some type of home and community-based services. And I've noticed that a number of our members are doing social accountability type of activities. What we need to do more of is what Becky and Bill are doing, is really getting their stories out there and really publicizing it and using the Holleran tools are really helpful in getting used to documenting everything that you do and then releasing that information to the community, to the politicians, statewide, nationally, as well as everyone in the community so they get to know you. So it'll help your philanthropy efforts. It'll help your, advocacy work in your communities. And, we hope that you do take advantage of the toolkit on the Holleran website. And we'll have this, this webinar available on the Leading Age website, as well as Melissa will have it available on the Holleran website. All right, thank you, Melissa. And hopefully we have some questions for any of us, for Bill, Becky.
Thank you, Peter, very much for speaking to all that stuff, social accountability. We do have a question. What has been the best way to get staff to really understand what social accountability is and engaged enough to report all that they do in social accountability? Becky Lochner here from Holleran is willing to answer that question. Peter, do you have anything you'd like to add before she gets started?
No, if she can answer the question, then I'll just add in if there's anything else.
Okay.
That'll be fine.
Okay.
All right, thanks.
That's a great question, and I think actually, thank you to the asker of the question. I think that's where a lot of organizations are right now, and I just want to flip on our slides for a minute to our social accountability model. And you can see that commitment is at the bottom as the foundation, and it's so important to spend many, many months on the commitment phase. And I think that, what I've encountered as I go out and visit different organizations and talk about social accountability is that a lot of organizations are doing social accountability, but their staff are not calling it that. And so it's happening, it's taking place out there, but it's not known as such. And so, that's a really great question, is to how do you get your staff to better understand social accountability and to know that what they're doing, to know what they're doing and why they're doing it and what it contributes to in the big picture. So one of the things that if you've seen the toolkit or you are going to use the toolkit, some of the things that you'll see in the commitment phase of the toolkit are lists of objectives for a social accountability committee. You'll see a job description for, the individual who's responsible for social accountability, and also some tools for how to address your board about social accountability and start some of these conversations. But I think that, from where we sit, that's the big piece, is that having a really strong foundation is about getting the message out to everybody and making sure that you have buy-in from everybody at the very beginning of this, before you even get into the programming piece, but understanding the why for social accountability. And I'd be interested to hear from Becky and or Bill about what you've done specifically with your staff.
Well, I can tell you that one of the things that we've done for our staff is that we try and keep them as much as possible. We have very little staff turnover. They are involved in all of our planning efforts. We do provide health insurance for them. I think we pay 90% of it. We have a work schedule that they help develop. They are involved in the work schedule, and they see what's happening out there, and they see what's happening to our participants, and they like what they see, and they talk to people about it, and they stay with us. We have less than a 10% turnover because of that.
Very good. Thank you, Bill. We do have another question from a participant. It says, I've heard that the IRS wants to see the 501 giveaway services to prove their eligibility for tax-exempt status. Does the IRS perspective have anything to do with the push for social accountability activities?
And I think Peter, Peter can probably answer that better than I can, but yes, yes, and yes to the asker of that question and anyone else who's thinking about that. That certainly has a lot to do with with the push for social accountability, the IRS role. However, one of the big messages here or takeaways is that although the IRS is pushing 501c3s to demonstrate their tax-exempt status, your message to your staff and to all of your constituents should be that this is an extension of mission. So it should not just be as a, it should not just be to fill the requirements, in other words. So whenever it's for a regulatory purpose that takes away from the story that you're telling, keep that in mind. Peter, did you want to add to that?
Yeah, I mean, I think we have to look beyond the tax issue. It's definitely an issue for our members that are continuing care retirement communities. I think over the last couple of years, I've only seen 2 cases that a home and community-based service provider was, questioned concerning, tax-exempt status. But I think the important issue for social accountability is, like I had mentioned, being that provider of choice, but also being the employer of choice. Like what Bill had mentioned, that such a low turnover rate that, when people in the community see that Daily Living Center is giving so much to the community, it makes it a place that they want to work. So, there's just so many other benefits for social accountability. I think it's not as a clear-cut, the tax issue, as with continuing care retirement communities. It is still important, and it may become more important over the next couple of years with state budget cuts and state budget deficits. So it's not an issue right now, but in the future it may be.
Okay, thank you, Peter. Peter, we actually have another question for you. It is, what is your rationale for claiming the volunteer service of staff members as organizational community benefit? Peter?
Yeah, volunteers. I mean, the volunteers. That's part of your mission. So anything that when you're documenting the volunteers' time, you're documenting really activities that relate to the mission of the organization. So I mean, I don't think it's inappropriate to document that time, because that volunteer is there to serve their community, and your organization as a not-for-profit is also there to serve the community. So it's just an extension of the mission.
Thank you, Peter. We do have one more question. We have about a few minutes left here, so let's see if we can get through this question yet. Please provide more specific information on how staff is encouraged to report matters that can be used for social accountability to administrators.
Could I just weigh in on that one? I used to work for a hospital, and a not-for-profit hospital, and I was in charge of some of the home and community-based services at the hospital. And every year we used to do a social accountability report that we did a press release on. We included it in a number of media releases that we sent out, and as well as our annual report, et cetera, et cetera. But what we used to do is it was required that every department head in the hospital had to include in their monthly report the social accountability activity. So everyone reported to their supervisor what they did that month. We also had an employee recognition program. So if you had that employee that created a wonderful program for the community, that it could be a blood pressure screening, it could be inviting a local nursery school over, or a Head Start program over to do an arts and crafts program with the people with the patients in the adult day program. Whatever you do, if that employee took the initiative, we'd always recommend them for the employee recognition program. And we would have luncheons for them. We also had an employee of the month. So I think it's really important to give that recognition to the employees that take that initiative to do that special program that, again, makes you stand out as that not-for-profit provider in the community. I think that really is the catalyst of getting everyone to report their social accountability activities, getting everyone to know that, you're going to be rewarded with recognition, for the special things that you do.
Yeah, very good. Thank you, Peter. While you were speaking, Peter, we did get another question that asked, is this time that staff should be paid for, or are they volunteering on their own? And I think it's safe to say, and Peter, I know we have about a minute left here, that this is time they should be paid for, correct?
Yes. I mean, I don't know if Bill or Becky could answer. We always paid our staff for that activity, although there were certain activities sometimes outside of that the staff would actually volunteer their time for a particular activity.
We have
something special. Yeah, Bill?
We have staff that will, it's an hour program, and they'll stay an extra 30 minutes because everything's going well. We don't pay them for that.
Right.
And
okay.
And I agree. Same with us at Entrusted Hearts, the Baptist Villages. We have both. We have individuals who are volunteering their time, and we have staff that it is paid part of their time that they're being paid for.
And the individual who asked about the tax-exempt status, when it comes down to demonstrating our status as a not-for-profit, it is important to have the paid time for the volunteer hours, because that is actually quantifiable dollar amounts that you can report back. But as we're talking about the other side of social accountability, absolutely sending that message that volunteering on behalf of your organization, whether it be paid or not, is definitely something to encourage with all of your staff. But just keep in mind that there is an element there of tracking that does need to be paid.
Correct. All right. Thank you very much, everyone, for your questions. And I thank our presenters, Bill and Becky and Peter, for contributing today. We are out of time. Our webinar time together has come to an end. I just would like to remind everybody that there is a very quick survey at the end of this webinar, just asking you how useful it was and how, what you found to be beneficial. You can see on your screen right now there. You can see Peter's contact information as well as my own if you have any additional questions. The last reminder I will say is that this webinar will be available on Holleran's website and also through Leading Age for those who would like to view portions of it again. So thank you very much, everyone, and have a wonderful rest of your day.
Thank you.
Thank you.
Thank you.